Good day, Austin. We're talking acne with Dr. Ted Lain from Steiner Dermatology, which is perfect. Back to school. You know, a lot of teens battle with acne.
Yeah,
and so going back to school is just kind of like you want to feel confident.
Carrie, it's not only the teens, it's the preteens, it's the moms, it's everybody,
Yeah,
unfortunately,
right.
this time of year.
Oh, okay. So it's just, we can't really fight it because it's hot and humid out.
That's right. That's exactly right.
Well, you're going to help us out with a few tips to kind of alleviate some of the puffiness and the redness and those bumps. Help us out here.
You know, I'm seeing a lot of teenagers come in right now trying to get ready for school because they want to put their best face forward, especially that first week of school. It's really important for them. Sometimes we don't understand the stresses that teenagers are under, and having a good appearance helps them out tremendously. So I just went to my local grocery store and I found 3 products. Specifically, I'm looking at ingredients rather than products. I brought these, but these are certainly not the only ones that are out there. Really, it's variations on a theme of ingredients, okay, Carrie? There's salicylic acid is one ingredient that really helps acne. And the other is benzoyl peroxide. Now, almost every product that you find over the counter is going to have one or both of these products. There's not much else that's available in over-the-counter products to help with acne. So what I've got here is a benzoyl peroxide wash. It's got 10% benzoyl peroxide. You're not going to get higher than that when you look at over-the-counter ingredients in acne products. And this is something you just literally use to wash your face once or twice a day. Make sure you wash it off completely because it can bleach your towels.
I was just going to say, I have learned that from experience.
That's right.
And that benzoyl peroxide, it just kills the germs, kills that bacteria?
You know, it has a couple of effects. It doesn't actually kill bacteria. It's called bacteriostatic, which means it stops it from growing, but it also helps to exfoliate a little bit, which is one of the problems with acne. Over here, I've got a moisturizer that's got a little bit of salicylic acid. Now, this has got about 0.5% of salicylic acid. In over-the-counter products, you can get up to 2% of salicylic acid, and you don't really want to go much higher than that because it can cause a lot of irritation unless you really know how to use it. And this is a leave-on product. Certainly, if you're going to be outside, you're going to want to use a sunscreen over this. And then over here, I found what's called a sport wipe, and this is something to use after football or cheerleading or something like that in the midday. And this has got a little bit of salicylic acid and some benzalkonium chloride, which is, again, something to kill the bacteria. This is just a wipe that you can use to wipe off the sweat and some of the oil that accumulates during the day.
Can you use that on your body also? Because I know some teens will battle on their chest or their back.
That's a great point.
So they're athletes, right?
Yeah, that's a great point. You absolutely can use it on your body as well.
And then also, maybe this is me just being a woman, but sometimes when you use some of these products, and if you are battling acne, you've got that excess shine. So does the salicylic acid and the benzoyl peroxide, does it kind of keep that at bay a little bit?
You know, it'll help a little bit. There's some certainly there are some prescription products that will help more than this, and there's some over-the-counter oil control products. Something like OC8 is one that you can buy, I think, even at beauty stores, which can help control the shine as well.
All right. And a couple tips, in addition to using the products, is wash that face every day, but don't scrub hard. Why not? Well,
you don't want to break the skin, and sometimes teenagers especially go a little bit too hard with their scrubbing, and they use cleansers with little particles in them that can break the skin and cause more acne.
Oh, well, we don't want that. Okay, this is a big one. Don't pick at any acne bumps or squeeze them.
You know, when you squeeze them, especially when they're filled with a little bit of pus, the pus comes out, but it also goes in a little bit, and it can cause more inflammation. And so that's something you really want to let the ingredients in the acne medications work with.
And try to keep your hair off your forehead and hands off the face.
So the hair on the forehead just keeps that grease and grime stuck to your skin, and it increases your acne. Hands will transfer bacteria to your face.
And why do we need to use these products daily, whether they're over the counter or we come see you and you prescribe us some? Why daily?
Because acne is a daily problem. And this is something that only works for the day. It doesn't give you a long-lasting benefit. It has to be used every day.
And it doesn't just stop at teenagers. I am a testament to that, unfortunately. So you see patients of all ages battle acne?
Absolutely. Preteens. Sometimes I even see 6- and 7-year-olds with a little bit of acne.
And
brought in by their moms, and the moms are very proactive about it. They say, you know, I battled this as a teenager, and I just want to make sure we get on top of this early on.
And of course, if you have any questions, whether you're a mom or you're a teenager or preteen, go see Dr. Ted Lain over at Steiner Dermatology.